David McGettigan is a pain and movement specialist. He specializes in helping the people who fall between the cracks in the medical system, the ones who are bounced around from practitioner to practitioner and who have lost hope of resolving their symptoms. David has previously taught courses in a reflex-based therapy called PDTR in multiple countries across Europe and currently runs 2 busy clinics in 2 locations in Ireland and Iceland. I was so impressed with David's ability to hold all of the information that science teaches us about chronic pain while also being able to talk about it from a way that is flexible and kind and compassionate. That's not something we usually see when people are super evidence-based. Usually it's like, you're just not doing it right. If and you're broken or you're this or that, whatever. So I was really, really impressed with my conversation with David, and you'll hear him talk about his new program at the end of the podcast. And he says it's coming out soon. Well, that day has already arrived. It came out yesterday, and he is currently taking beta clients right now. So you can head over to davidmcgettiganclinic.com. The link will be in the show notes. And you can sign up for his pain program. He really goes over a lot of the pain science foundations, as well as gives you really practical and adaptable strategies that work for your body. He's worked with people with all types of chronic pain syndromes and symptoms. So I think that you're going to really enjoy this episode, and I hope that you'll find it helpful. The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe, while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learned here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Hi, David. Thank you for being here. I would love for you to tell people where you work and a little bit about your clinics and, how you help people.
Thanks, Destiny, for having me on. David McGettigan. I go by the business name, David McGettigan, Pain and Movement Specialist. I work primarily with people who have chronic pain. I have been doing this work now for, I think this is my 15th year. And I typically meet people who are struggling, who've kind of fallen between the cracks, who have maybe bounced around from different therapist to different therapist, from doctor to potentially to surgeons. Sometimes I've had surgeries that haven't gone so well, stuff like that. Get a lot of referrals from physical therapists, from personal trainers, all that. And I aim to kind of meet them where they're at. I've been through my own symptoms, as I'm sure we'll get into. And I mean, I help those people make sense of what's been happening, trying to put the pictures of the jigsaw puzzle together that's led them to where they're at, and then start helping them make sense of it all and create a plan to move forward. So I'm based in Ireland. I have a clinic just outside Dublin Airport, which is quite convenient for the few clients I get that fly in. That's my secondary clinic. I'm there one day a week. I have a clinic in my hometown as well. And I also, which seems to be quite random, I travel to Iceland every kind of 6-8 weeks-ish and do a large weekend clinic there. I've been doing that for 4 or 5 years. So I do bits of online stuff as well. So
that's really cool. What is the thing that you do in Iceland? What is
it's just a clinic. It's a clinic. So I was involved in helping teach a course, and that all stopped around COVID time. It was a neuro course, and I was teaching people out there, and basically, COVID stopped everything. So I ended up becoming a dad that year as well. So I ended up stopping teaching, and I sent an email to, or the lady who's running the clinics and hosting the courses sent me an email and said, David, we've got people asking if you're coming back. Would you be interested? So I sent an email and it just filled up a full weekend of work, and it's just been rolling ever since, basically. So it's just helping people. Like I meet people with chronic pain. I meet people with weird things like chemical sensitivities, multi-chemical sensitivities, all that side of things. So I've helped people there in that way as well. And yeah, just help them best I can.
Yeah. Okay, well, this might take a turn a little bit because
Yeah, maybe.
we do talk. I mean, I've had like physical therapists on the show, and we haven't really done an episode on chemical sensitivity. And I'm not asking you to be an expert on that, but I would be
Yeah.
curious to know like what you notice about chemical sensitivity and how you do start to help people with that.
Yeah, so this is going to take a different turn, but that's okay. So part of the training I took when I was like, I've gone through loads of different trainings. Understanding movement has been a huge part of what I do, all the different joint interactions when we walk, etc. And then I realized during my kind of years of trying to implement that with people that I could assess somebody to the top level that I could. And I could say that they needed to be able to side bend their spine left and turn their neck this way, but I couldn't get their body to take it on. So even though I knew what I thought I knew what they needed, I couldn't get their body to take it on. And what I started to realize was that yes, the joint motion side of things is so important. And at the same time, if I can't help that person's nervous system have a safe experience of the movement they were missing or of the symptom or of the area of the symptom, then I was probably going to struggle. So I invested in a neuro course and I ended up teaching bits and pieces of that. But for that neuro course, what you would see with multi-chemical sensitivity would be along the lines of most of those people have had mold exposure first, primary mold exposure, or mostly it's that. Sometimes it's a kind of illness and secondary effect to medication and stuff like that. And their system's been really burdened, and they've been usually in hospital, they've been like on the floor sort of thing. And I think, again, I'm not an expert here. I actually have loads of clients that are doctors. You could probably get some of them on and they could chat about their experience of it. Would be cool. But I think what happens is we get so overloaded when our systems are on the floor that it's quite easy for us to become sensitized. And some of that neuro work would look at like the input systems from body to central nervous system. And if we have, particularly up around the head and neck, it seems, if we have sensitization there, then a secondary consequence of that tends to be smell sensitivity. And the smell sensitivity can trigger a whole host of different symptoms, is what I've seen. So if I can do the strange neuro work that I do to desensitize their system, usually up around their head and neck, we can often help them stop the second order consequences of the sensitivity, if that
And
makes any sense.
yeah, it does. It does. I'm wondering if the neuro work is, I know mindset is always a part of everything, but is it mostly mindset work or is it physical stuff that you're doing?
Well, it's actually like sensory work on the sensory channel. So like I could probably give you an example. I had a lady who had a mold sensitivity, ended up with she's Icelandic. She eats fish and has eaten fish all of her life. She ended up with a fish sensitivity that was so bad that she needed an EpiPen afterwards. So we had worked on other stuff, and she eventually said to me, David, I want to see if we can sort this out because I miss fish in my life. It was so good for my health, whatever. And through a process of testing her system's response to fish, we were actually able to figure out what was driving that, desensitize that thing, and she could then almost immediately start to eat fish again and went forwards and has been eating fish since. So it's not going to be that case for everybody.
Yeah.
It
And
can be
forgive me if I'm getting too granular, but
No, go for it.
I like, is this a matter of exposure work mixed with some safety signaling or
Yeah, so I would kind of say that's definitely part of it. So you need the exposure work afterwards, and I mean, I would always encourage graded exposure for anyone to any problem, whether it's something to do psychological, whether it's something like I've just explained, or whether it's movement back after an injury or something like that, I always think about, if I can, the primary signaling problem that might be happening in their system. So to transpose this to a different context for a second, I might get someone who has knee pain and has every MRI, every scan, ankle, knee, hip, etc. There's nothing on them. And when we assess them from that sensory lens, we might see that they have reduced output, motor output to their quads, or reduced output to their calf. And when we restore that, we then see them start to make some progress. So you see these kind of, I don't think people look at this that often. So maybe this is kind of something you're familiar with, but a lot of people are trying to respond to what the responses are instead of looking at what's maybe driving them as best we can. It's not always easy, but that would be how I look at it. So from the chemical sensitivity, I want to see if the sensory system is having any problem. And if it is, then can we normalize that if possible? Sometimes that is just graded exposure work if there's nothing I can identify, to put it that way. If there is, then I would do my best to do some treatment on that, desensitize, with the hope that that leads to the second order consequences, having different responses or more normal responses. In effect, it's like trying to restore normal in the system, because what they're displaying already is an adaptation.
An adaptation, which is a word I love, rather than like abnormal, because abnormal means wrong.
I'm with you. Dysfunction is the word I deleted from my diary and my dictionary a long time ago.
I love that. Let's talk about that then. Why do we use adaptation instead of dysfunction or abnormal?
Because I don't think, unless you're unfortunate to have some sort of rare injury, brain injury, something like that, nerve injury, I think everything is within a spectrum of what's possible, even if it's not what we want, right? So rather than say it's dysfunctional, that's along the normal of what's possible. And I absolutely hate when, and I used to be guilty of this, so for any clients that are listening, I apologize for this, it's part of my learning journey. I used to say dysfunction, and actually what I think that meant to a client was something really different than what I was intending it to mean. And I'm really careful now about how I speak to people, how I choose to use my language, because I know that, like, I meet the people who come into my clinics that they basically regurgitate what therapists have said to them in the past, and those are the things that people fear. Those are the things that we carry around on our back for years sometimes. And I really don't want dysfunction or that implication that we're fragile. If we're talking about pain, I don't want that to be coming from me. I don't think it helps anybody.
Right. So if you and I are talking about, like, if you and I are using the word dysfunction, but we both know that it doesn't mean broken, permanently damaged, all of that, then we can use the word. But most people have context of this is irreparable. I'm not going to be fixed, and this is damaged for life. And then that's why we want to use different language to have it, make sure there's just a different conversation.
Absolutely. And I mean, if you're sitting as the person who doesn't maybe have background like yourself or myself might have, if someone says dysfunction to you, that means something's going wrong. And actually, if I refer back to what I said earlier, that these are normal occurrences along the spectrum of what you'd like to what maybe you don't like, they're not dysfunctional. They're adaptations that are possible in your system. They might not be pleasant. They might be driving your symptoms or a big part of it. But that doesn't mean it's abnormal or dysfunctional. It means it's a functional response that's maybe not what we want, if that makes sense.
Totally. It reminds me of inflammation, which is there to help heal wounds, and like, what are some other functions of inflammation?
Well, yeah, it's basically a repair process. It's part of the body's repair process after injury. A lot of the time, like, maybe different from the chronic low-grade inflammatory stuff that's signaling something different. But yeah, like, if it's a necessary part, it's a normal part.
I think. Sorry to interrupt. I think you had just said maybe different from like low-grade chronic inflammation. And the way my brain conceptualizes this, you can tell me if you correct this, right? Is that it's constant, there's a constant injury happening on the daily, whether because there's low vitamin level, like there's a malnutrition somewhere, or there's a like mold, you're living in mold and you don't know it. And so in my mind, like, that is what's causing the chronic inflammation, which is still an adaptation. It's constantly trying to repair, but
Mhm.
then, of course, causes damage over the long haul. Is there anything you would like shift about that?
Yeah, so like I think when you start talking about low grade inflammatory stuff, I think about metabolism. I think about metabolic issues. I'm a total geek. If you haven't heard already, judged it
Okay, me
already.
too.
I have been down a rabbit hole for the last probably 4 or 5 years on circadian biology because I think that's a massive missing piece for most people. And I mean, if you go into the kind of science behind it, you end up quite quickly getting in front of mitochondria as an important part of our health. And I think what you'll see with low grade inflammation is it's a problem with the inputs we're giving our energy systems that end up creating problems for how they work, and then the end result is like low grade inflammation in different tissues and whatnot. So like I would always kind of say that if you can sort the environment you're in, the inputs you're giving it, you can often get this machinery inside of us to work really well. And if you want to talk about inflammation, if we give the inputs and remove some of the problematic things, then we often end up seeing that person really, really thrive.
It makes me think of my own blood work. My inflammation levels were starting to look really, really good right before I had kids.
Changes everything, right?
And I'm 3 years in now. I have a 3-year-old and a 1-year-old. And this past year has been the hardest year for sleep by far,
Yeah.
worse than my first year with my first kid. And my blood work, my functional medicine doctor is like, so cortisol is at like 0, your inflammation levels are up, you're depleted in B12. And
Eh,
I'm like, yeah, it's all sleep. Nothing else has changed. Like this is pure like lack of sleep.
Absolutely. And that ties into what I was saying, like that circadian side of things, you need the awake thing and you need the dark thing too. You need the light and the dark to get everything functioning properly. So yeah, 100%. I mean, it's so important.
Yeah, and so that makes me think too, like this like lack of sleep is like that for me, and the way I conceptualize this low grade inflammation, it's like every night or when you're lacking good sleep, it's like that constant injury. You're just not like having the full
Yeah,
system to repair.
yeah, you don't like, I mean, most of that repair stuff does happen whenever we're sleeping. So if your sleep quality gets affected, then there's going to be like, you're not going to have as much melatonin release. You're not going to have as much melatonin you're making. Melatonin, if you go back to mitochondria, it helps repair and restore those, and they are immune system organs as well as energy functioning organs. So it makes sense. It makes loads of sense. And I mean, obviously, when you're a parent, which I am, I have two, 4 and 2.5. Like it just is what it is. You have to kind of roll with it and get on. And I mean, if this was someone who had a chronic illness or chronic pain, who was a new parent or whose sleep was struggling, I would say to them that if it's something like parenting, it's a phase, and fingers crossed the sleep will resolve or will get better, and you should find that that will get better too, and hopefully that will reassure you that if you can get your sleep back on track, then you can recover some of the progress you've made, or you can increase your how well you feel. You can get better basically, and that it's not hopefully something to freak out about because maybe it's normal for your symptoms to be a bit worse if your sleep struggles. I actually think that's really, really important for people to know.
Yeah. Yeah. And this is your body working. It's telling you the signals that it should be telling you when you're sleep deprived. And yeah, it does pass mostly when you're a parent, unless you have more and
Yeah,
more.
yeah, I know that too. So yeah.
But do you do any work with clients around sleep? Like what kind of education do you do? Do you do like a CBTI kind of thing, or is it your own kind of yeah.
So I've kind of come at this through my own learning, I suppose. My sleep was all over the place when I was in pain. I probably slept for maybe at times 2 and 3 hours a night, so I was like all over the place. Um, and that was a huge piece for me. It was a huge part of my symptoms starting to improve. That plus a lot of self-exploration, mindset, movement. There's loads that I did, but sleep's a huge part. Like I know from reading the research that sleep is a significant factor in pain control, your intrinsic pain control. Like you can sleep poorly for a few nights and be at a much higher risk of experiencing symptoms, not because your structure has become injured all of a sudden, but because your own control internally, unconsciously, your control of the pain, your pain systems and all that has been just completely altered. And that takes time to get back on track again after sleep disturbance. So like it's something I would ask my clients about, like, how is your sleep? What's your sleep been like if they've started to experience a flare up? Have stressors kicked in and your sleep suffered? All that side of things. And I do give them like quite specific advice, like to have that. Happy to share if you want to hear it.
Yeah, please.
For me, again, it's like it's circadian based stuff. For me, good sleep starts in the morning.
Yeah.
It starts with natural light exposure to make some melatonin on your skin and in your eyes. Ideally for 20, 30 minutes if you can in the morning time. Ideally as close to sunrise, but that might not always be possible with maybe kids or where you are in the world. It could be dark before work and all that. So ideally we get that light exposure in the morning, and then we get it again ideally around sunset if we can. We're trying to sync our internal clock up to nature because that's what we evolved with, right? And the eye is the main pathway for that, the eye and the skin. So if we can do that kind of syncing up with nature's clock on a regular basis, that could be as simple as opening a window. That could be as simple as getting out for a short break, for a walk on your lunch break. That's huge. That actually matters so much more than people think, and it's free when you do it. The other side then is to, maybe not exercise too late in the evening, to avoid the heavy foods later on in the evening time, to do your best around the light exposure you receive in the evening time. Blue light, I think the blue light from our screens and all that stuff, it suppresses melatonin release by, I think it's up to like 80%. So if we, let's say,
I haven't heard that number before.
Let's say if you and I are twins and we have the exact same day, we go out and we get our morning walk, we build some melatonin in the morning. We have the same day, no stressors, but I've been watching Netflix for 2 hours before bed and you've been reading a book, maybe with the declining light or with a candle or something. If we take a blood draw, my melatonin is circulating, it'll be way less than yours. And I've read 80% myself. I can't say that that's fact, but I think it's quite significant. So if melatonin is the thing that keeps you asleep when you get to sleep, and if it's the thing that repairs your little engines in your mitochondria all the time and helps your immune system kick up into gear and all that, then I think it's pretty important for anyone with pain, health issues, etc. Just any human being, to be fair.
Yeah. Do you think everybody needs to sleep like, 9 to 6 or because there's this concept of different chronotypes, like some people are night owls, some people are like, how do we account for those different types within our sleep education?
Yeah, got it. So I personally think if you go back to, I have no evidence of this. This is how my logic works. If you go back to when we were cavemen and cavewomen, we would have more than likely got up when the sun rose and went to bed when the sun went down or close to that time. So I think when we talk about night owls and we talk about, people that aren't night owls, I think what we're talking about is probably people whose behaviors and habits, their environment is set up to prolong their being up at dark and they don't realize it. I think it's that. And I would imagine, I know there's research that shows there's two clear types and stuff. I would imagine if you did kind of really, really detailed research on that group of people who would consider themselves night owls, their rhythms are out of sync with what their bodies ideally would have. We can still function there. We can still live there. I know from reading the research that, people who, as an example, shift work are way more likely to have mental health difficulties, are way more likely to have cardiac problems, to be obese, to have diabetes. There is definitely a link with that. So I think whenever you're talking to someone who might be a night owl, it would be attempting to get them to shift back by a small amount for a while and then shift back by a small amount and put in those inputs again that help your internal clock sync up with what you'd like. I think that's key. If we don't do that bit, it's going to be really hard.
I mostly agree. There's one, I used to think the same thing about, like, if you think back evolutionarily, and then somebody mentioned this concept of like, yeah, but there were people who like stayed awake by the fire at night to protect the village. So they were up by fire. But I still wonder if those people who were in charge of this high stress job and like maybe they also were not very healthy when they were doing that. We don't know
Yeah,
because this was like thousands
yeah,
and thousands of years ago. Um, so that's one part that comes to mind. The other thing is I know within CBTI is cognitive behavioral therapy for insomnia. It's just a manualized kind of
mm-hmm.
approach. And it can take, I mean, some people will benefit in like 2 weeks, but other people it can be up to 5 months to really like redo that circadian rhythm. So I know it's possible to rewire that rhythm and that pattern, even if you are a night owl. I do just sometimes, I always get in my own head about like when we're trying to make changes, are we trying to change something that's like fundamentally okay with us, but we're just trying to change it because society lives a certain
Mm-hmm.
way. They live from 7 a.m. to 10 p.m. or is it like, no, it's not really just about society. It's also, this really is like the best thing for you to change. So I always struggle with those two concepts.
Yeah, sure. I mean, I would probably say that based on what I've read and what I've heard from people who know a lot more than me, I think that the way we live our lives now is not set up for how humans should do things if fully health wise. And at the same time, that's how the world is. So we have to have some kind of meeting in the middle there. And I think it's about what you can do. I suppose it's little hinges swing big doors. If you can make some small changes that benefit your sleep, and that's all you do, you're going to have better mood. You're going to have better kind of appetite regulation. You're going to probably have better pain control. You're going to have more likelihood to engage in health promoting behaviors and stuff like that. So I would always see, if that is a small little win that we can get, I'd be all for that.
Yeah, you mentioned the pain control piece a little bit earlier. I wanted to go back to that. You mentioned it in a way that the way you said it was really it was really good. I understood it really easily. It was like when you're lacking sleep, there's something that is then altered with the pain
Yeah.
control centers.
Yeah.
And so it's this vicious loop. Can you talk a little bit about
Yeah,
when you,
so I
yeah,
think that the easiest, I'll explain how I explain it to clients. Our bodies take input from our tissues, every part of our body all the time, 24/7. Nerve endings are sending signaling in. And probably if we were to listen to every single piece of that, we would be overloaded, overwhelmed, wouldn't be able to function, right? So our system obviously has inbuilt kind of filtering processes for that, right? I like to think of this really simply, like at the level of the spinal cord or some part of the spinal cord into the brain, there's like a channel that's closed. And you can sample it at will, but there's a channel that's closed. And that channel is set to stay closed most of the time. When we have good quality sleep, the research I think says between about 6.5 hours and 8.5, 9 hours, channel stays closed. When you have more than 9 hours and when you have less than 6.5 hours, channels can open. And all of a sudden your system can be bombarded with input that it may not have been receiving as much of before. And I think what that will do is it will shift processing internally in your central nervous system. And a lot of times, if there's maybe nociceptive input, which is kind of threat detection system input, if that's coming in, more of that's coming in, it naturally causes our system to move towards processing threat rather than safety. And that probably drives responses in terms of pain. That's how I kind of explain it with clients. It's a bit wordy, but they seem to get
no,
it.
yeah, no, it's perfect. And it does explain the neuroscience stuff without it being like, this is a mindset. And therefore, if you're in
Yeah,
pain,
yeah,
you're
no.
not thinking
No,
properly.
I'm never going to say that to someone. I know you've obviously heard that from clients or from your own journey, because if you just bring it to this as a mindset, it's almost like this is your fault. And there's none
Yeah.
of this is anybody's fault. I can't ever say to someone that you could be doing better because they often don't know. They often just don't know. And I
Yeah.
can't ever, I would never place blame on anyone because of that. So between the knowing and the actual achieving is also another set of steps. You can know it, but to actually put it into practice is hard. Change is really, really hard.
Yes.
But support's needed, right?
Yes. Yeah. Support. Exactly. That's where I think the mindset work comes in, with trusting that you can do this work when it's really hard, or searching for support to then help you do this really hard work if you don't have that in place now. Like, there are things that we do have some choice over, but it's always in constant um contact with our external environment. So our environment's impacting us, we make a choice that impacts our environment, and then it ebbs and
Yeah,
flows like that.
absolutely. And I think when you talk about maybe what I would deal with most would be chronic pain, like people, I don't think people realize that their central nervous systems are probably more primed to take negative experiences on board easily than positive ones. So that makes the process of change a little bit harder. And I always kind of, how do I put it? I always orientate my clients towards developing evidence of safety. It's a massive key. It's a key thing for me and for my clients. If I can help them find a way to develop evidence of safety for them, for their unconscious system, about their body, about their environment, whatever you want to call it, I think that is a key thing. So, you know, that might be something small, that could be something huge for another person. You know, it's a key concept. If we can get them to do that, we can at least provide some evidence that that you're safe to move, let's say, even though they may have loads of evidence that to the contrary. We need to keep developing that evidence of safety, because we can't just delete out memory. It'll still be there, but we need to develop evidence of safety. And sometimes support is needed. Like, you need to be able to bounce ideas off somebody, to ask questions. To most people I meet don't know what to do. They know they want to get better, but they don't know what their next best step is. And it's
I
huge.
love that. Yeah. Yeah. And then this is also where some of my work comes in, because like, as a therapist, I am working with personality and trauma and mindset and things like that. But it's always in conjunction with, again, with what is, not like you need to think
Yeah.
differently.
Yeah.
Um, yeah. It's looking at what kind of personality traits do they have? Are they more of an avoidant type of person, or a more anxiously attached, meaning they move toward problems? Avoidant people move away from
Yeah.
problems. And so we look at all of that, and then we can kind of develop this. Well, this is the kind of support that you need based on
Yeah.
who you are as an individual.
Absolutely. It's so important. I mean, I often would say to clients, like, and I even know the therapists, if I'm talking to them, like, meeting the person I'm in the room with is the most important part of my job. Because if I don't know people that well, sometimes clients I've worked with for a long time and I do know them quite well, but most people I have to kind of do my best to get a read on how they handle things, in order to know how to support them more effectively. Because I could prescribe homework for someone, let's say, that just is not going to have that capability, and that's not going to help. So we have to maybe do stuff with them here, or you know, it's knowing your people, meeting them where they're at. So important.
Yeah, I agree. Um, do you have any tips based on you said at one point you were sleeping like 2 to 3 hours at a time. What helped you, mindset or physical, like changes and stuff, the sunlight, but what were maybe some other things you had to overcome there?
Yeah, so like when my wife would always say when I met her that uh she's a complete sleep. She loves her sleep. She would sleep really, really well, and it's been a foundation for her. So we were like at opposite ends of the spectrum whenever we met. And she would say to me, David, you do know it's not normal to get up and cook food at like 11 p.m. And for me, I was just that dysregulated. I don't think I knew how dysregulated I was. So it was actually awareness of that that really started to help me, kind of put some perspective on where I was at. I mean, most of the time when I was really struggling with my sleep, I was away from home. I was studying my degree. I was a student. I had very little money, and I was kind of just being a student. Do you know, I was partying and doing all that. So there were factors there that when I took them out, when I started, when I moved home from doing my degree, and I was back in a bit more of a routine, and obviously when I started working for myself, then I had times I had to be up and active, and that kind of enforced it a bit. But I think I'd say to that it was awareness that I was actually doing things that were slightly abnormal, or maybe more than slightly. And I didn't really think of anything of this because when I was younger, I had decent energy. So I could push on if I needed, even though I was in pain. And I didn't really know, like I didn't have any awareness that sleep and pain were really that linked. And it was just part of my journey to understand that. So like I think if you can take a step back and look at how your day to day generally goes, and compare it with what maybe would be best for health, then you have to know what that is in the first place. That would be useful because then you might see a big contrast, and that big contrast might hold some gold for you.
Yeah. One thing that was really eye-opening for me, I didn't realize this until I was pregnant and I was dealing with like massive, massive fatigue more than anything I ever had. But I would get really hungry when I was tired and trying to push on. And I was like, oh, I'm mistaking my hunger cue, my tired cue for hunger. Like my body's like, okay, well, if you're pushing past your limits, then we need some energy, go eat. But if you just go to sleep, then you don't need to eat. Not like diet
Yeah.
talk. This is like, yeah. So when you said, you'd be up at 11 cooking, my mind went to like, yeah, your body was tired, but
That's him. The exact
yeah,
same. I had hung. The other one would be like mistaking thirst for hunger. Getting a signal I wanted something, I would actually be thirsty, but I was that dysregulated I couldn't maybe make the connection, and I would make food instead, which does have water in it, but it's not what I needed, right?
right.
And I mean, it's other things like I think one thing that's really important for clients and for me as well, like I would find that certain symptoms would be indicators for me, and I know that now. Maybe years down the line, I'm probably, I want to say I'm 30, I'm probably about 10-ish years past most of the majority of my symptoms. I was struggling for maybe 10, 15 years before that. I would often get my neck would lock up, like a wry neck or whatever. My neck would lock up. And at the time, I thought that was a disc problem when I was catastrophizing, doing all the rest. When I get that happening now, it's a clear indicator for me that my system is overloaded. Most of the respiratory muscles are up around our neck and our diaphragm, obviously. And when they go into spasm for me, that's a clear indicator for me that my sleep has not been on point, that my workload is too high, that I'm stressing around something. And now I see that as like, all right, time to cut the cord and get back to basics. Like I'm by no means perfect on that front. I know what has worked for me and I practice them as much as I can, and at times it goes out the window. I'm a parent as well and all that.
So important to talk about that as well when we're teaching this stuff, because yeah, people are like, oh, they cracked the code and now they're perfect and they never hurt any. No, like, yeah,
Now we're human. We're still human.
yep. I do. I have this very specific pressure in my head that happens when I know I didn't get a good night's sleep. And then other like sensations in my body that it's like, yeah, you've just been working too much. Like it's even if it's not like I haven't had enough sleep, it's maybe I haven't had enough time without doing work related tasks. I haven't been playful enough. I haven't been
Yeah.
carefree enough. And I can feel that in my body now. Whereas yeah, before it was like, oh no, I injured something else inside.
I think no, for me it brings up that piece of the meaning we assign to our symptoms. Like if we have a meaning that's quite fear-inducing, worry-inducing for us, that'll further escalate things. Whereas with hindsight and time, and obviously I've been on a journey with my symptoms for a long time, that has now transmuted into, okay, we can cut the cord and calm things down and focus on the priorities again to get me back to where I want to be feeling. But that doesn't come without experience and without help.
Exactly. Yeah. I think like making meaning of a symptom, like if you're doing cognitive behavioral therapy in session, a CBT therapist would be trying to help you figure out the actual meaning, the true meaning, but you might not have enough information to make it make sense. And I think that's where people get derailed because they're like, well, then it must be my fault. And so
Yes.
there's this kind of backlash against that kind of work. But in my experience, and this is why my clients actually get really frustrated with this process, understandably, but my process is all about acceptance and observation. We have to keep observing and collecting data and observing and collecting data before we make any meaning of it and
Mhm.
learning. And because if you make too much, if you try to force a meaning out of it, it might not be the right meaning. And then you just feel like confused,
Mhm.
wrong, and broken even more.
Mhm.
So I'm a big fan
No,
of observing.
Absolutely. It's key for me. I mean, pretty much every client that I meet will have meanings that have either been made internally by themselves or have been handed to them from other healthcare professionals, which I kind of mentioned at the start, they bring it on their back. And it's unfortunately most of those things are throwaway comments that people have latched on to somehow, and they're promoting the idea that their body is fragile. They're promoting the idea that this person they aren't able to get past this. And I mean, I would be kind of watching out for that type of thing with clients. I'd be listening for it. I'd be asking them questions to probe a little about what they understand to be happening in their body, because I put it this way, I call it the unconscious storm. I could be giving you the perfect rehab plan, the perfect treatment and rehab exercises, but if I haven't helped you uncover the unconscious meaning and the unconscious storm that's sitting there, that's basically meaning your system is perceiving your body as an unsafe place, as a fragile place. If we start putting exercise on top of that without dealing with that meaning piece first, we're probably going to have a threat response rather than a safety response. And I know which one I want, obviously, right? So, and I know which one the person wants, even if they have no concept of all of this stuff. It's about, awareness again, helping them become aware that these things matter. I mean, most clients with pain will imagine that or will link that to some element of tissue injury, whether it's disc issues, degenerative change, tendinopathies, broken bones, muscle pull, whatever. And I mean, we're conditioned that way because, you fall when you're a child and cut your hand and it's bleeding and you associate pain and tissue injury, and it's hardwired for us that way, which is fair enough. Um, as you know, it's not always the case. There are many, many factors that can cause pain to appear in your life. Um, so it's always important that we check in with how that person's relating to pain, if that makes sense.
Yeah. And do you find yourself ever having to be careful, like around, so you're teaching people basically that they're not as fragile as they may have been led to believe, which is something, yeah, I also relate to heavily, like learning that my body is stronger and that I can't push it. And even like I had a heel pain that started this past year, and after like 4 months of working with my PT, we were like, okay, it's not feeling better. There's been some little improvement, and it clicked for me, like not walking on this heel, because like there's no injury here, and not walking on it is not going to help me.
Okay.
So I just straight out asked her, like, if I start walking on my heel again properly, it'll hurt, but am I going to do damage? And when she said no, I was like, okay, that's all I need. Like, I can move on.
Reassurance, right?
Yeah, I needed her in particular because I trust her.
Absolutely.
Right. Um, with that said, how do we be careful that we're not pushing the message that you should just push through pain and like,
Yeah, for sure.
yeah.
Yeah, no, absolutely. Like reassurance that you're safe to move. I mean, when it's appropriate to give that message is number one. I think it was Louis Gifford. There's a great physiotherapy writer who's passed away since, but he wrote that reassurance is one of the most effective painkillers you can get. So I totally subscribe to that. That's the first part. And the second part is pacing. I mean, you know yourself, graded exposure pacing. It's to help the person understand, first of all, like how long is this likely to take? What might we need? Like most of the connective tissue in our body takes anywhere from 6 to 8 weeks to start showing signs of change. So if we know that as a rough guideline, we can pace a bit more appropriately. Whereas if someone thinks, oh, I need to do these exercises for 2 weeks and then I'm sorted, well, it's on me, I suppose, or on the person who they're working with to lay that out for them so that they're clear and they don't push too quickly too soon. So like I'll often say to my clients, like, I don't want you I don't mind a little bit of discomfort in your rehab whenever we're starting to work through something that's painful, but I don't want you getting above a 4 or 5 out of 10. I don't want you waking up with more pain the next day. We've probably overdone it. And giving them kind of indications as to what would be appropriate for them, and like sometimes the other side of it would be to know what change looks like. A lot of times it's not just the symptom disappearing, it's the ability to walk an extra mile, or it's the ability to walk upstairs more quickly, or it's being able to bend down and put your shoes on. It's little things like that. Even if there's a bit of discomfort, it's trying to get all of that happening so they kind of know all right, this is a good sign. This is a sign that I want to maybe take a little bit of note of and keep an eye on. And also that the time required to change can be significant. I don't know if that person needs 3 or 4 cycles of getting their tissue to adapt for 6 to 8 weeks before they're fully ready for the activity they want to do. But we have to start and build gradually in a way that is sustainable, right?
That is such good, like for me anyway, and so I would assume for listeners too, like to hear that, like not only 6 to 8 weeks for this, but you might need another 6 to 8 weeks
Yeah.
of because your tissue is repairing in layers, if we can say it that way. And so you're healing like a layer at a time. Is that
Yeah, I mean, if I put it to you this way, like sometimes people, because of maybe in previous injuries, they've adapted how they move, or maybe they've been up and lying up with a cast on or something like that. And let's say if they want to get back and play rugby or play American football or play soccer or something like that, the levels of force you might need to deal with, or maybe times body weight could be quite high, but you maybe are a lot lower than that right now. So we might need a process of 6 to 8 weeks to earn the right to get to the next 6 to 8 weeks, to earn the right to get close to the body weight stuff. To then, it really depends on the individual circumstance. So it's knowing that, yeah, it's going to take time. Like I've had clients walk in with tendinopathies all over the place and told them that, look, it's going to probably take you 4, 5, 6 months. We can be active in this process. We can still do some stuff, and maybe you might be able to get back to training with some discomfort, but with a base that's building. And I always think of it like the base of a pyramid. Can we build up your tissue capacity to handle everyday stuff first? Then obviously kind of more sport specific stuff if you're going to be talking about athletic endeavors. And then like really specific to skills and tasks they need to do if it needs to go that way.
That's really, really helpful. I can see too why your clinics would be so successful because even well-meaning PTs and trainers and when a client comes in and says like it's been 10 weeks and I'm still in pain, they're like, okay, all right, we're gonna regroup, we're gonna try this, we're gonna try that. And I mean, I want my PT to like be thinking of things they can do for me better. And at the
Sure.
same time, this just might be the second iteration of needing to repeat the same stuff because we're just in that second 6 to 8 week time
Yeah,
span.
sometimes people need. I think that comes back on the therapist and knowing what you're dealing with, I suppose, because if you can lay out for a person that, look, I expect this to probably take this amount of time for you to be feeling like this, and we'll troubleshoot along the way if we need to. And at least as early doors, it's a realistic expectation. I mean, that's been something I didn't know how to do when I started out. I had to learn that the hard way. Clients that would drop off, clients that would kind of maybe say, oh, well, it worked for a couple of weeks and then didn't work, when I didn't realize that I hadn't helped them understand that they shouldn't be pushing back to go running yet. That was on me to maybe help them understand it, and maybe my experience was part of that too. Um, but yeah, it's a huge thing. Pacing is massive, and if we can pace well, we should probably minimize the chances of flare-ups. It's not always possible. We probably minimize that, but at the end of the day, you can't cheat nature. It takes time. Just takes the time it takes for your tissues to respond, right?
Yeah. This has been so great. Is there anything that you feel we didn't touch on that you want to touch on? Any kind of main point about your work or the human body?
Um, no, I mean, I'd just like people to know, if they're listening to this and they're on the client side of it rather than the therapist side of it, that change can happen. I have a firm belief, because I see it all the time. I've done it myself and I see it all the time. Change can happen. Our bodies and brains are plastic. They're able to change at any stage in life. You might not know what to do. That's obviously, you could be on YouTube and Instagram and God knows where looking for help. There's probably nothing like a one-to-one with someone who you trust. And at the same time, you can still find resources that are really, really helpful. Knowing what to do and what to work on is the hardest part. So if you can get some guidance that way, that's really helpful. And then I think simple things like learning the skill of managing flare-ups. Knowing that it takes time for your body to adapt to loading, and knowing that consistency is important. Knowing that the event is never as important as the trend.
Yeah.
Things like that to keep you on track, to help you manage the internal chatter that comes up, all of that. Like if we can get you heading in the right direction, that's the first piece. You'd be surprised how much you can change with consistency and with some simple application. I mean, obviously that's quite open-ended. I just want people to know that change is totally possible. I've seen it so many times.
This is amazing. Where can people find you?
Yeah, so I'm on social media. On Instagram, I'm at Pain and Movement Specialist. On Threads as well, which is where we met. On what else am I? I'm there on Facebook. I'm David McGettigan, Pain and Movement Specialist. And then on TikTok and YouTube, I'm at Bigger Than Pain, which is something I'm kind of moving towards. I'm gonna release a new kind of online platform for people with pain sometime later this year. It's called Bigger Than Pain. So let's meet you there.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then.